on behalf of all my legislative colleagues representing the Interior Health Authority region from Trail to Castlegar, Cranbrook to Sparwood, Osoyoos to Enderby, and Williams Lake to Merritt, and all points and communities throughout the Interior. Joining me tonight is my co-host, Clovechok, MLA for Columbia River Revelstoke, and also with us are our special guests, Susan Brown, the President and CEO of Interior Health, and Dr. Sue Pollock, Chief Medical Health Officer for the Interior Health. I'd also like to acknowledge that I'm here tonight on the traditional territory of the Shewepin, the Okanagan-Selaik, the Townhall, and the Sinaik peoples. And I also recognize that you may be joining us from other territories throughout the province. And before we get started, I also want to recognize the sacrifices we have all made together to help stop the spread of COVID-19. We have flattened the curve together, which is amazing. It was a collective effort. And I want to thank everyone for doing their part. I also want to thank the people on the front lines, our healthcare workers, those in the grocery stores, those who make sure the supply chains keep strong throughout the Interior, because it's a big area and you've all done such an amazing job. I know some folks are still going outside at 7 o'clock making lots of noise. I hear them in my community as well. And I'm now going to hand it over to my co-host, MLA Clovechok, to give us a quick overview of what this town hall will look like. Doug?
Well, thank you very much, Minister Conroy. And I, too, would like to recognize that I'm broadcasting tonight from the traditional territories of the Shuswap Indian Band of Tunaka, and also the Métis communities in both Columbia Valley and Golden. And like MLA Conroy, I share her thoughts on how proud we are of the people of British Columbia and the Interior Health, who have worked so hard to flatten that COVID-19 curve. And all of the sacrifices that you've made individually have collectively paid off dividends for all of us. So we want to say thank you so much. And personally, thank you to the people in my riding. You've done such a great job. It's been tough. It's still tough. We're not done yet. And I know we won't quit. So let's just keep that going. And I also want to acknowledge the chiefs of staff in the 3 hospitals that service my riding. Dr. Chris McKenzie in Revelstoke, and Dr. Megan Guy in Golden, and Dr. Gareth Mannheimer in Invermere. They have been just amazing leaders. And I want to thank them and all of their staff, everybody in the hospitals, and as Minister Conroy said, the grocery stores, the RCMP, the pharmacists, all those people who have worked so hard to make this what it is today. And I also want to acknowledge the extraordinary community spirit that we found in British Columbia. People like Don Gingras and Golden, who's continues to make masks for all of the communities. And a big shout out to Jim Ashcroft, who's 101 years old. He's one of the last surviving Burma medal recipients from World War II. He's walking a block a day for 101 days. He's trying to raise $101,000. So he is just an absolutely amazing man, and what an inspiration. So just the spirit of people that have come out during this thing is just unbelievable. And last month, the BC government organized a series of regional health town halls so that your questions could be addressed by the people who are dealing with COVID-19 on our behalf and here in our province. And being well informed and following public health guidelines will help and have kept us really, really safe. And I'm pleased that we have another opportunity tonight to do that. And it is my absolute pleasure to introduce to you again Susan Brown, who's the CEO of Interior Health, and Dr. Sue Pollock, who's the Chief Medical Health Officer for Interior Health. And let's start this off by letting you guys introduce yourselves to everybody, and start off with Sue.
Great, thank you. So I'm happy to be here tonight with everybody, and I'd like to acknowledge that I am on the traditional territory of the Syilx people tonight. And I'd just like to express my extreme gratitude to all of my public health, fellow public health practitioners in the Interior region, certainly to the medical health officer colleagues I have, but also to our numerous other staff who've been working day in and day out on this COVID response. And as has already been mentioned, we're seeing some very positive results from all of the efforts, not just from our healthcare staff, but from our individuals and communities at large and our businesses. And we certainly have work to do over the next few months, but I know we're all up for it, and I certainly am. And I look forward to answering your questions tonight.
Susan.
Hi, good evening, everybody. And I'm just across the hallway from Sue here. So I'm also in the traditional territory of the Syilx people. And it's great to be back with you tonight. Like, this is our third town hall, so look forward to updating you all on what work has transpired and what we've still to do over the coming few months. But I do agree it takes a village, and there's been tremendous support from the public to get us to this point. So we just extend our gratitude for your support.
Well, thank you both so much for joining us again tonight, and we're looking forward to getting started. And in advance of this town hall, we've asked British Columbians to submit their questions on COVID-19. And MLA Conroy and I would like to turn everybody's questions and hear everybody's questions and get those questions asked. And either Dr. Pollock or Susan will be doing that. And if you're watching on the Government of BC Facebook, you can submit your questions in the comment section down below, and we'll have a chance to address them. You can go ahead and start asking your questions right now. And with that said, let's begin, and it's back over to MLA Conroy.
Thanks so much, Doug. And let's get things rolling here with our first question on a topic that many folks are looking for updates on. People in this region are looking for an update on the number of COVID-19 cases within the Interior Health Authority region. For example, Kathy in Blind Bay asks, how many active cases of COVID-19 are there in Interior Health today? And Teresa in Kamloops adds, of the total number of COVID-19 cases in the Interior Health region, how many are recovered?
Great, I'm happy to take that one. So we have had, as of this morning, we've had 195 cases of COVID-19 in the Interior Health region, which has been mentioned as a very large geographic area. I'm happy to report that 191 of those individuals are now classified as recovered from COVID-19. So they're recovered, they're out of self-isolation, and they're doing well. And we continue to have 2 active cases of COVID-19.
Awesome. Well, thank you, Teresa and Kathy, for that great question. And here's a question that's been asked many times on other town halls here as well. Can you comment again on the reason why? This question is from Jody. Can you comment on the reason why we don't disclose the details of location instead of giving information only about the Health Authority region? And Jody asks, how many people have or had COVID-19 in the West Kootenay region?
So we've talked about this quite a few times, and we are following the direction of our provincial medical health officer. So we have some communities that are actually quite small, and divulging a location of a person could maybe expose them when they don't want to be exposed. But we have definitely explained where there's been outbreaks, for example, in long-term care facilities or in some other areas. So like, for example, we know we had an outbreak in a nursery. So like the nursery in Bylands in West Kelowna was publicized. So we're really trying to make sure people's privacy is maintained when they don't want to be exposed. And also it gives a false sense of security that you wouldn't have COVID-19 in your community when you might very well. So really trying to focus on making sure people do the distancing and the good guidelines, and not so focused on thinking maybe they don't have it in their community and they can just ignore those guidelines. So keeping focused on people need to keep diligent, and everybody doesn't stay in the same place throughout the province anyway. So much as we want people to stay close to home, we know people have to travel for work at times.
That's so true, Susan. Thank you, and thank you, Jody from Trail, for that question. And it just reminds me, I wanted to acknowledge all the great staff at Kootenay Boundary Regional Hospital who are doing such an amazing job of keeping people safe in our region and making sure that people stay healthy. So they're doing an amazing job. I had the occasion to visit not too long ago, and it's really important what a great job everybody's doing there. So thank you. We're now moving into questions around long-term care during this pandemic, and we know that restrictions were put in place to limit visitors in long-term care, seniors assisted living, and acute care facilities, which were essential to protect patients and staff against the transmission of COVID-19. I know government recognizes how these measures have personally impacted seniors and their families, and they weren't taken lightly. Having said all that, Ashley in Merritt asks, why are we not allowed to see our parents in long-term care facilities when they have a gated-off patio area, and we can be 6 feet away and actually talk to our parents without a phone? And why are we not allowed to bring treats and drop off for them? That I'm talking store-bought things like chips and chocolate bars?
Yeah, these guidelines have been very hard on families. We can understand that for prolonged periods, not seeing loved ones, and obviously people in long-term care, much as we're trying to keep them physically well, that emotional piece has been difficult for people. We've heard that many times. We are starting to, the health authorities work with the provincial medical health officer around what could be the next phase for long-term care. We know the weather's getting better now in lots of areas, and as has been noted, there are outside patios. So that is some pieces that we're looking at so that families can be united and actually have time together. But that will need to be done very carefully to make sure that obviously our seniors who are the most vulnerable are kept safe. And the actual piece around food and packaging, we know that the virus can live on surfaces. So really just trying to keep that strict adherence to what goes in and out of the facility. The time when it would be appropriate for a family member to go in and get an exemption is with obviously if there was any concerns around family members being palliative and times when it was essential that a family member could be present. And that people should speak to the administrator or the manager that's at the long-term care facility if they have any concerns around that.
Well, thank you very much, Ashley, for that. And I know it's heartbreaking and so very difficult for families. And Vicki and Armstrong adds a little bit to that. And the question is could one family member allowed into a long-term care facility in the IH area to help with the care of a resident? And Sandy from Cranbrook and Kimberley would also like to know what plans are currently being worked on to allow safe visitations in long-term care facilities.
So again, sticking to those strict adherence right now until we work provincially together to make sure whatever the next steps are, we all do them together. And as we say, there's, because the weather's getting better now, there's probably some opportunity to look at those things and open the guidelines a little bit with simple next steps. But I don't think it's going to be a big step and multiple people seeing the same individual in long-term care. So it will be a very cautious next step to make sure that people can be united. But again, trying to limit the amount of contact that those seniors have.
This is another question along the same lines, but it's about visitations in hospices. Michelle in Vernon asks, will the protocol change soon to allow more than one designated person to visit hospice patients? Michelle noted that her mother has terminal cancer and will likely need hospice care in the coming weeks. So I do want to send our thoughts out to Michelle and her family and many other families who are facing difficult times and already having to deal with this, not being able to see family members who are in hospice facilities.
Yeah, that's extremely difficult. And obviously the one person designated family members for, again, limiting, but I think it's not the same as being in person, but people are doing some very creative things around exactly what we're doing tonight, sort of virtually being there and being able to express their feelings, but it's not the same as reaching out and touching somebody. So I think as things progress for palliative patients, that's when there is an opportunity for family to speak to the facility and see if there's something different they can do to have more family members present.
Well, thank you, Michelle, and our prayers and our hearts go out to you and your family. Our next question around long-term care focuses on the single site directive done to keep healthcare workers and patients safe. And Dennis in Kelowna asks this question. On May 27th, our premier admitted that part-time staff working in 2 or 3 long-term care facilities are now only allowed to work in 1 to ensure that we were not having transmissions from one facility to another when it comes to COVID-19. Since we know that healthcare staff can bring the virus into our nursing homes, why aren't we testing them all first?
So the first thing I would say is anybody can take that virus into a long-term care facility. That is really just what we've been talking about around that strict adherence to the visitor policy. So it's anybody. And the single site staff being at one site and not splitting their time over working in two separate facilities was done as an extreme precaution to ensure that we were not taking any virus between facilities. But I would say in the interior, we've done a great job between our public health officials and our local staff, and also those facilities that we contract with, of making sure that anything that did pop up was dealt with right away, and there was no passing of the virus to anybody else. So I think our facilities have done a wonderful job, those that we contract with and are owned and operated, and I think they've done a great job with staff ensuring that they understand what personal protective equipment to use and making sure that all the people they care for are safe. So I understand why we went to this extreme for staff, and throughout the process we're making sure that no staff member loses any income or anything in that process.
Thank you. And those seniors are, of course, are so vulnerable. So we just, we have to make sure that those procedures are put in place. Karen in Kelowna has our next question, which focuses on reopening her business in care facilities. And she asks, when will I be able to reopen into retirement residential care facilities to provide what I believe is essential foot care for seniors? Mobility is becoming increasingly difficult for many seniors still in lockdown.
Mm-hmm. Yeah, so I've had a few conversations with our long-term care team around foot care. And my understanding is there is a variety of different types of individuals who provide foot care. So first and foremost, as Susan has mentioned, we want to try and minimize the number of people going in and out of long-term care homes, but also moving between long-term care homes because of the vulnerability of that group. However, if this is a medically necessary service that cannot be provided by the existing staff in the long-term care home, then there is a process available to an individual such as this, who can engage with the long-term care facility to seek an exemption to what is our single site order so that she could actually access the long-term care facility to provide those services.
Thanks, Karen, for that question. Another topic that we've received a lot of questions about refers to our province's surgical renewal plan. It was a very difficult decision for government to halt non-surgical surgeries, or non-urgent, I should say, surgeries at the start of the pandemic in order to prepare our healthcare system. However, May 7th, government announced surgeries that were postponed are starting back up as part of a massive surgical renewal. As such, folks like Jesse from Kelowna would like to know, when are elective surgeries going to start being done, and what will be the priorities, and how will it be decided which surgeries are started with?
Great, thanks. So yes, we're well on the way to getting elective surgeries recommenced. So we have contacted over 1,300 people to understand, are they willing to proceed with surgery at this time? Some people may choose not to, but they will not lose their spot on the wait list if they choose not to proceed at this time. And just over even the last week, from May 19th to the 24th, we've completed more than 700 surgeries. So well on the way back to or as much of a normal circumstance as we can. All 16 hospitals within the interior that do surgical procedures are back up and running. So right now we're trying to understand who's on our wait list that are urgent, that need in to have their surgery within 4 weeks, and we're doing that now. And then the next group that we're interested to understand is anybody whose their actual condition has deteriorated a little bit while they've been on, or they've been in pain, trying to get those people in as quickly as possible. So that's a discussion with healthcare providers and the patient themselves. And then also looking where we can maximize surgeries that people don't have to stay overnight for, so day surgeries, and then procedures that can be done outside of an operating room situation, for an example, cataracts. So we're trying to maximize those two others to take any strain off the ORs themselves. So lots on the go, and we will do everything we can to get as many people in safely for surgery. We do know that with the procedures and safety measures that we're putting in place, that it does take a little bit longer. There's about 30% drop in the number of cases we can put through in a normal day. So we're looking to extend our days and go into weekends, and expanding surgery at sites. We're making plans to do that. So well underway, and hopefully we'll get to people as quickly as possible to get their surgery completed.
Great, Susan. And this is a question from Annette in Vernon that she'd like to know, when will screening tests such as FAIT, pap smears, and mammograms start to be done again? And I really want to hear the answer because I need a mammogram too. So this is a good one. Thanks.
So the FIT is the FIT test. Some people may know it. It's a screening for colon cancer. And so that's done at a laboratory. And then there's mammograms and some other outpatient tests. So any tests that were required for diagnostics, meaning you were symptomatic or had some problems, we would have made sure that we got you in for that test at some point. So for diagnostics, if it was something that was urgent, your primary care practitioner would have advised, and we would have had you come to a site that could do that test. For screening, that is actually under Provincial Health Services Authority for mammograms, if it's a routine one. And I would assume that they'll be getting their routine screening back up and running pretty quick here. And for any other procedure that was done at the laboratories haven't actually been closed. So if it was anything urgent, your primary care practitioner would have said, we need this done, and it would have been completed as usual even over the last few months.
Well, I hope that helps, Annette. And as we all know, we're now moving into the BC government restart announcement. We know this is a week-by-week process, and we're encouraged by what we've seen so far. But we need to remember that COVID-19 has a 2-week incubation period, which means any new cases that are a result of easing the restrictions will start to appear over the coming week. Keeping that in mind, Sharon from Vernon asks, it's very discouraging and stressful to see people shopping in stores with no regard for distancing. What can be done to convince shoppers and store management to take COVID-19 seriously?
So I can only speak to Kelowna because obviously I'm not traveling much these days to and from the office sometimes. But where I have been out and about locally, I actually think the businesses are taking this very seriously. I have seen them go to extreme measures of making sure their stores are clean. They've got people doing hand sanitizing when they come in. They're making sure they haven't got a lot of people in stores at one time. Where a business is not taking things seriously, if people are worried that you see overcrowding or things that are in blatant against the guidelines that are produced for us, then we will follow up on any complaints that come forward to Interior Health. And obviously, WorkSafe BC is keenly involved in this and have produced a lot of the guidelines for the province and what is acceptable for different businesses. So there is an avenue if people feel that there's a blatant disregard for the guidelines.
Sharon, it's such a good question. I know, and people, I see a lot of stores taking it very seriously. And I ran into Safeway the other day on lunchtime and had to grab a few things quickly before I got back home for another meeting. And I ran down, grabbed a thing, and this little guy looked up at me and he said, "Excuse me, ma'am, you're going the wrong way." Mm-hmm. So people take it very seriously, and so it's great to see. I'm really happy to see it. But as we move forward with the restart plan, we are slowly making steps towards increasing our bubbles. And Judy in Kamloops asks, in practicing outdoor social distance visits with friends, can you offer your bathroom to guests to use? Also, is it safe to have one couple over for dinner inside as long as a window is open near the table?
Mm-hmm. So that has a few different parts to it.
Yeah.
So we'll first start talking about outdoor social distancing. So kudos to this individual. So that's a nice way of starting to slowly and cautiously expand your social bubble to have, a few friends, a small number of friends over, where you can be outside and enjoy some of nature, and also at the same time physically distance from one another. So it's still really important, even if you're outside, that you are distancing from each other and having that 6-foot distance between each other. I would expect in a gathering, an outdoor gathering of a small group of people, that somebody may have to use the bathroom. So it could be that one bathroom is designated for the guests, and you can provide the guests with some sanitary wipes, Lysol wipes or something with some bleach in it, so that they can just clean up the high-touch surfaces after they leave the bathroom. So they can clean up the taps and the toilet handle and maybe the countertops and maybe the doorknobs as they're going in and out of the house. And that would keep things much safer.
Go ahead. Sorry.
That's okay. There is a second part, I think, to the question.
Bathroom, and if a couple comes for dinner, and if you leave a window open, will that help with the dinner?
Right.
So
yeah. So this again speaks to I think people wanting to increase their social bubble, and we have heard from Dr. Henry that here in phase 2 that we're in currently, we can start to do that a little bit, and again slowly and cautiously with small groups, and so. That social bubble may be increased because you're going back to work, and maybe it's your work colleagues are in your new social bubble, or it may be that your kids are back at school, and so now the kids have a new social bubble, or you may choose to identify one couple or one family that you want to increase your social bubble with, and so just to remember that their contacts now become your contacts, and so we need to be very, very careful. If you're having a couple indoors and they're part of your social bubble. It probably doesn't matter so much whether the window is open or closed. What's more important is the maintaining the distancing and the hand hygiene, try not to touch your face. And of course, we shouldn't be going into people's homes or having people over if we are ill.
It's a lot to remember.
It is a lot to remember.
Very, very important. And we've got a question here tonight from Rose in Kelowna, who's kind of along that same line, who's hoping for a little clarification on gathering sizes. And her question is this: how large can our gatherings be starting in June? Can it be more than 6? And we're hearing a lot of this. When will churches be allowed to open again?
So there is I'm sure as most people are aware, there's a provincial health officer order from Dr. Bonnie Henry about gatherings, mass gatherings. And so mass gatherings of over 50 people are not allowed in the province. And so those really speak to those one-time one event gatherings that may occur, like a big wedding, for example. That doesn't refer to people who are in Costco. So Costco has other measures in place to ensure safety. So Costco may have more than 50 people. That's not considered a gathering. So gatherings of over 50 people are not allowed. Again, speaking to just increasing our social bubble in phase 2, we want to do it very slowly and very carefully. So we do want to keep our gatherings small at this point. It's not forever, but certainly in this phase. And again, like I alluded to in the last question, maybe just choosing one other couple or one family that you want to increase and add to your social bubble. And just keeping in mind that those you add to your social bubble may have underlying health conditions or maybe at higher risk because of maybe they're elderly. So just to consider those factors in your social bubble as well.
And of course, exercise and getting outdoors is really important. And we have a couple of questions around swimming. Nancy in Ashcroft and Linda in Kelowna have these questions. When can outdoor pools open? And why are swimming pools closed? Chlorine kills virus, right? And swimming is helpful for my physical therapy.
Yes, well, I love swimming, and my 12-year-old daughter has been asking me when she can go swimming again. She thinks she's going to forget how to swim, and I said, you won't forget how to swim. So there are new guidelines that will be released very shortly from the province. It'll be posted on the BC Centre for Disease Control website. It'll be guidelines for pools to reopen. So that we're in phase 2 right now, pools are going to be allowed to reopen. And it's true, it's not about the water. There's no evidence of transmission of COVID-19 through water, and especially when it's chlorinated water, and as it would be in pools. The higher risk with swimming pools is the congregation of people in and around the pool, and also in the change rooms where there's, again, high-touch surfaces. And so that's what the guidelines will help provide recommendations for in terms of enhanced cleaning, but also the spacing that'll be needed between patrons. But it's coming.
Well, we've got a question here that we hear a lot. Where I'm a MLA in a border riding in British Columbia and Alberta, and interborder travel has become a big issue. And it's certainly something that's a top of mind. And with regards to out-of-province travel, Dennis in Penticton has got this question. We are considering travel to Saskatchewan to visit family in mid-June. Are we okay to travel interprovincially? And if we do make the trip, would we be required to self-isolate upon our return?
Mm-hmm. So one thing we're promoting for this summer, at least, is to stay as close as home as possible. And we've heard this from Minister Dix and from Dr. Bonnie Henry a few times. But it's really the summer for us to explore BC and explore the region that we live in and be a bit of a tourist in our own town. And so really the recommendation right now is to stay close to home. And as we move into phase 3, that may be, travel within BC. And so really would recommend that individuals in the interior region stay close to home this summer in BC. However, there is no requirement at this point in time for a 14-day self-isolation period if somebody does go to another province. And we do recognize that there is a lot of travel back and forth, certainly between BC and Alberta, for essential services and other needs that need to be met by both provinces.
I think it's a good time to see what a beautiful province we really do have. We don't need to go anywhere. It's great. Yeah. So we have some more general COVID questions for you tonight as well. Ruth in Williams Lake asks, can a blood test tell you if you have COVID?
So great question. And we have a couple of tests. I'll just speak to both of them briefly. So the test that we're most familiar with right now is the nasopharyngeal swab. So it's a swab that goes inserted into one nostril, and it's trying to pick up some of the genetic material of the virus. And that helps us determine whether somebody is infected or not. So that's what's been happening with all of our testing up until now, to determine if we have cases or non-cases. The blood test is something different. So that's a test that looks for antibodies in our blood. And there are a number of good candidates for an antibody test across the world. And here in BC, we're looking at a couple of different tests, and we're trying to validate them right now so that they can be used more widely. And once we're ready to roll those blood tests out that will look for antibodies, those will tell us which people have been infected with COVID, and some that we probably didn't know they were infected, and may also help us to determine whether or not someone is immune to COVID-19.
Okay, it looks like we're pretty much done with the written questions, and now we're going to take in some of the ones that people are sending in to us tonight. So we've got one here, a live question from Kira tonight. Can you please tell me why a private outdoor pool in the Strata complex cannot open? However, public pools are opening as well as public playgrounds.
So I can't speak to that particular situation of that strata, not knowing where it is and what it is. But there certainly should be possible for a pool in a strata to open, again, using those precautions. So although there wouldn't be somebody supervising, there may be ways to encourage with signage to encourage that there be limitations on the numbers that are in the pool itself, and to just encourage good sanitation and good hygiene while in the pool. Of course, people bringing their own towels and taking away their own towels. They're probably something to take up with the strata itself. And if there's any concerns about that, our team here of environmental health officers can also help provide some support and guidance around that issue.
Okay. And Beverly has another question about long-term care homes. What about inter-facility transfers between long-term care homes? When will we be able to move our parents to a different facility?
Yeah, that's another extreme measure that we took to make sure that we were not, of course, traveling the virus between any facilities. So we had done no inter-facility transfers and actually stopped admission to long-term care facilities for a period of time. So we will be starting to look once the visitors policy is looked at, and then what that will look like for people that are waiting to move to a different facility. Again, it comes with some risks, so it will be done with caution when we do start doing that again. But we will make sure for people that have been waiting that they do not lose their spot on any wait list that they've been on, to have their loved one either brought closer to them in their community or to a community that they wanted to go to. So again, we'll be looking for that provincial medical health officer guidance on when those types of situations can start reoccurring.
Great. Just waiting for our next question to come up here.
You can tell a joke, Doug. No.
I'm just going to go, we have a question here from Sylvia about something she heard from Interior Health and helping the homeless. Interior Health asked me to open our feeding program for the homeless back when the outbreak began in earnest. So we serve about 26 takeaway meals. When will we be allowed to offer sit-down breakfasts? And we previously staggered people over 3 hours.
So thanks, Sylvia, for all you do. That's amazing doing that for homeless. I'm sure that was really thanked by them because a lot of businesses have had to close during this time. So when you move towards having people sit down, it will be the same guidelines as if you had like an eatery or a restaurant like anybody else. So you would want to space people out, make sure that they're not crowded. And then, of course, if there's people waiting to be pick up their meal, that they're not congregating together. So just all the same guidelines that any restaurant would have, and just those are easily seen on WorkSafe BC. Their guidelines are posted, and also you could call them if you needed advice.
Hey, this is a question from Darlene that's near and dear to my heart. She asks, are childcare centers in the Interior Health region being monitored?
Mm-hmm. So the short answer is yes. So we do know that daycare centers were not required to close through phase 1 of the COVID response. And so some daycare centers have remained open from the beginning and some have chosen to close. So just given that there are a number of different guidelines that are available to childcare centers and daycare centers to ensure that they can safely operate, and both safety for the staff and also safety for the children. And we know that can be really difficult for kids, especially young kids, to physically distance. So there's a number of, I'm sure, tricks that are put in place to try and minimize the contact that kids have with each other and with the staff, while still providing that quality care. And so here in the Interior region, like the rest of the province, we have Interior Health has licensing officers, and licensing officers work closely with our daycare facilities to ensure that the best practices are used and that there's safety and care for all children there. So yes, they are monitored, and they are monitored by our licensing officers.
Doug, before you ask your question, I just want to say a big shout out to all the early childhood educators in the province. We call them the workforce behind the workforce, because those essential service workers, all those people that were out working, couldn't work if they didn't have those early childhood educators out there taking care of the kids every day. So just a big shout out to the great job that they've been doing.
I could not agree with you more. They're just awesome. And thank you for all that. And we've got a question from Karen, who's listening live tonight. And if we were to try to reopen, who do we contact to ensure our protocols and risk management plan are acceptable with Interior Health?
So it depends what type of business that she's trying to reopen. But there are a number of excellent guidelines that have been now developed by WorkSafe BC with input from public health. And the guidelines are available on the WorkSafe BC and BC CDC websites for the different sectors. So it would be important to go and look for her sector there and at the guidance document for that sector. And then in terms of monitoring of compliance with that will be done by WorkSafe BC, but also with support from our Interior Health and environmental health officers, depending on the type of business. So for things like restaurants and personal service establishments that come under some of the other bodies of legislation, our environmental health officers will be helping there.
Great. And Lynette from Kootenay Bay is asking, are patients that have been classified as recovered going through follow-up general health exams, or are they just classified as recovered with no follow-up?
Yeah, so recovered would be a definition we use based on either they have had negative tests or they've had a number of days without symptoms. And of course, we also would look to their primary care provider to do follow-up of those recovered patients. and any necessary additional health care that's needed once we've determined that they're recovered from COVID-19.
This is a question from Lorraine, and there seems to be some miscommunication around this a little bit. And the question is there any update on the virus living on fabric, plastics, and metals, and what's the timeline on all of that?
Yeah, I've heard lots of questions about that and about living on different surfaces and how do we prevent virus transmission from those surfaces to our hands. So I guess generally I'll say that the virus can live on surfaces from several hours to several days. And it depends on the type of surface, on the humidity level in the air, and also on the temperature. So again, depending on the type of surface. And one of the questions that's come up is around bringing our groceries home. And so I've been asked, should I be wiping down my groceries when I bring them home? So I don't wipe down my groceries when I bring them home. But I do a couple of things. One is I ensure when I come back from the grocery store that I wash my hands carefully, like I do anytime I come home. And then I put my groceries in the cupboard and then I wash my hands again. So I think that is something that we can all do. And I know that there's other measures that businesses are taking, like the libraries, to try and quarantine items for a number of hours or days before they go back out to the public. So I think that there's some innovative approaches out there.
Okay. So this question from Brenda is interesting because she's asking, when will doctors' offices open? And from my perspective, I know they didn't really close because I know that doctors have been doing appointments by phone. So I guess she's wondering, when will the doctor's office open for actual in-person visits?
So there's been a lot of primary care practitioners who have been able to see patients face-to-face. They switched, obviously, to do a lot of work virtually because it could be, and I think they've been very successful at doing that. But where you have a virtual visit, they may determine that what you've actually got is not something they can treat easily over virtual and may ask you to come to their offices. So when they've done that, much like any other business, they've got one way in, one way out, and they're doing a questions survey of you when you come to the door to see if you've got symptoms related to COVID. And obviously, if you have, they're treating you quite differently if you're there for a different reason. So I think the GPs have done and the NPs have done a really good job at keeping a vital service going throughout this. And it's actually something that we want to do in the Health Authority, as long as with many of our providers, is keeping that virtual piece going where it's appropriate. We've had a lot of feedback from people saying it's been so great. They didn't have to travel a long distance to go for the visit, that they managed to get what they needed over virtual space, and we would like to keep that going for those who want it. Okay.
This is a question from Natasha, and certainly one I think that we all feel a little bit. I'm sure missing my grandkids. But her question is, if families are wearing PPE, would this not suffice to support families seeing their loved ones?
Yeah, and I'm thinking Natasha's asking about just within the community versus in a healthcare setting, right? So again, speaking to the social bubble, if people are looking to expand that, they may want to expand that with some of their other extended family members that they don't live with. And in those cases, it's really a judgment call whether they want to use, wear a mask or not. And I think it depends on, again, whether any of the individuals would be deemed to be higher risk from COVID. And just a reminder that masks are for keeping our droplets in, right? They keep our own droplets in. They don't protect us from other people. So just really important to think about who's most vulnerable and what kind of additional context should be being added to their social bubbles. And maybe for right now, we really want to minimize adding additional people to their bubbles.
It's a hard one for grandparents.
Oh.
It is. This is Tony has a question that can we have garage sales?
I'm trying to think if I've seen any garage sales recently, actually, in my neighborhood. I've seen some people put out free stuff, but no one there. So I think it's something that is a possibility. But again, we need to think about distancing, right? Anytime we're opening up our driveway to other people, there's that risk of congregation and And I'm not sure that that individual households would be able to manage that the way that businesses can, where they put stickers on the floor or tape on the floor. So they'd have to be very vigilant about having people line up and be 6 feet apart. And I'm not sure that's a commitment that anybody would want to take on, because anytime we have a gathering of people without proper distancing, we have that risk of transmission of virus.
The next question is certainly is top of mind, seeing the school started today. And this is a question from Courtney. What will it look like for kids that have chronic illnesses to enter back into the school system?
So we know that there are a number of kids and their parents who've decided not to go back to school in June. I don't know what the exact numbers are, but schools are, of course, progressing very cautiously and are down to about 50% capacity on a given day. And along with the Ministry of Education and Public Health, have a number of safety measures in place that are designed to protect both the staff and the students. And kids are really interesting in what we've learned from COVID-19 is that they're less likely to be infected by COVID-19 and less likely to transmit the virus. And we see transmission of COVID-19 when children are involved. It's often within a household and from an adult to a child. So we've had very, very few cases of COVID-19 in children in the interior region and in the province. So they seem to be spared largely by COVID-19. However, given that this individual child may have underlying health conditions or risks, it's probably best to speak with their primary care provider before making a decision.
I know my grandkids were pretty happy to be, one of them got up at 6:30 this morning and kept asking every 5 minutes, when could he leave? When could he leave? He's very happy to go back to kindergarten. Here's a question. When will the blood tests for antibodies be available?
Mm-hmm. So we're waiting for that. I'm hoping it'll be within the next couple of weeks, but I don't want to give an exact date. But we will hear. I'm confident that Dr. Bonnie Henry will announce that once the antibody test is through its validation phase that it's in right now with the BC CDC.
This is a PPE question from Taz, and his question is, can you address the fact that paper or fabric masks do not filter the particle size of the virus?
So we rely in healthcare on medical grade PPE. So, and we know that in the majority of instances in healthcare, a surgical or procedural mask is adequate for protection. The exceptions are when there are procedures that involve aerosolization, such as intubation, where an N95 or respirator mask is used. So I'm confident the masks we're using in our healthcare setting do protect us, us and others from the virus and from transmission. And then there are also the opportunity for cloth masks or homemade masks to be used by the public in those instances where physical distancing is not possible. And those masks can be made from all different types of fabrics, including things you find around your house, like T-shirts and socks. And there's lots of do-it-yourself videos that can be found online. So masks do have a place, and we would encourage their use, again, where physical distancing is not possible, such as in crowded areas like on transit, or even in grocery stores where physical distancing is not possible, although hopefully it's set up to be possible there.
Okay. Diana's asking, is there any indication that the COVID-19 is a vascular disease?
Well, we're still learning about COVID-19, and it's amazing how much we've learned in just a short period of time here. And primarily it affects the respiratory system, both it could be upper respiratory system and or the lower respiratory system. And in people with more severe disease, we see pneumonia and sometimes more severe forms of acute respiratory distress syndrome, where people end up in the intensive care, needing ventilation. There are now some reports, and I've seen a few of them, about blood clotting and an increase in blood clots with individuals in COVID-19. So I think that's a very early days yet. It's likely associated with some of the inflammation seen with this disease. So I think we just need to continue learning and looking at the research that's coming out as we understand this disease more thoroughly.
Mario's got a question that's it's a personal question and probably around personal safety. And he says here, I work in a cleaning and workplace, put a new policy that we must clean everything with bleach. Before COVID, we used less harmful products. Should I be concerned about exposure to chemicals, and is there a maximum amount of time someone should be breathing in chlorine products?
Mm-hmm. Yeah, so somebody working with cleaning products should be following the product guidelines around what, if any, personal protective equipment is needed and how long they should be exposed to those products. So the first thing I'd say to look at what the product, say, monograph tells you. And then, of course, there's other avenues to follow through with, of course, with the actual employer, if they have concerns about exposure to harmful chemicals. And then WorkSafe BC as well can help answer any questions about that.
And Laurie is asking, what has to happen for health officials to say the pandemic is now over? How will we know when it is no longer one?
Yes, that is a question I can't answer exactly, but I will give a little bit of context around that. So the pandemic it's a global phenomenon. It was declared by the World Health Organization, and for a number of reasons. But certainly, we were seeing the Health Organization was seeing this impact in multiple countries around the world. And in order for a pandemic to be declared over, we would need for COVID-19 to a couple of things: either have a very good, effective vaccine available that could be administered across the world, so that people could become immune, or to develop community immunity or herd immunity, where enough people have been exposed to the virus and actually become infected that they now have immunity. And we still don't have a really good understanding of how long immunity might last once somebody's been infected with COVID-19. So we'll just keep watching carefully. We know that although we're doing so well here in BC right now, there are other parts of the world that are not doing well, and the World Health Organization's role is to watch that carefully, and then communicate with all of the other countries as part of the including Canada.
This is another PPE question from Randy. And he says, with it being widely accepted that using non-medical masks will slow the spread of COVID-19, why is BC not making it mandatory to wear masks in more places, such as all grocery stores where distances cannot be guaranteed?
Mm-hmm. So it's actually incumbent on the business to ensure that those protocols can be followed, including things like distancing. So if a grocery store, for example, feels it's unable to have people maintain physical distancing, maybe because that would require following every individual around for their entire visit to the store, then they may decide that they're going to hand out masks. And I know that some of the large chains are doing that now. So it's really up to them, the business, to make sure that their health and safety plans that they've done through WorkSafe BC are being adhered to. And the most important things that can be done to prevent the spread are, of course, the distancing, but also other things that can be, like other barriers that can be put in place, like the plexiglass barriers are really important and work really well. And we see those at the cashiers as well. And if people are concerned about going out and about, again, they can get a do-it-yourself mask following some of those videos online, by just remembering that keeps their droplets in and doesn't protect them from other people. So trying to keep your distance when you're out.
So Sarah's asking, what are your thoughts on businesses doing temperature checks on their employees or using a thermal camera to screen employees?
Mm-hmm. Mm-hmm. So temperature checks aren't always the most reliable, and they have been used in other parts of the world and other countries for COVID-19 and for screening of healthcare workers. But not everybody that has COVID-19 is going to have a temperature. And some people, as we know, we've learned, have had extremely mild symptoms to the point of not even knowing that they've had COVID-19 and can still potentially be spreading it. So again, I think there's other ways that we can protect each other. And certainly people who can do a bit of a daily health check and say, am I feeling well today or am I feeling not well today? And if they're feeling sick or not well, and that includes for their children, then they should probably stay at home.
Well, folks, we're at the 5-minute warning right now, and so we've got another question here, but I know the time goes very quickly. And I'll read this. It's kind of a Kootenai question that we're hearing a lot. We know that there are likely very few COVID cases in our region, and there's been very few cases in our region, period, as a very rural nature of our region makes us safer than urban centers simply because of the wide open spaces and fewer faces. Knowing what we know today, why are we not taking a regional approach to opening up and restarting the economy?
So maybe I'll start that one. None of our communities are immune from COVID-19. We can't assume that there's not people in the community because you actually wouldn't know. I think what is being done well is the great guidelines that have been put in place and the good advice that our medical staff are giving communities, that we're actually keeping in keeping with those guidelines, that it's not transmitting it. And people, as you started this whole call with, is like people are actually doing the right thing. They are self-isolating. If they're not well, they're not going out. So that is all slowing the spread. So I do not think you can think that there's nobody in your community that's got COVID. So the provincial medical health officers are saying slow and easy as we go. We know that, exactly as you said earlier, that if we increase our social contact so much, so quickly, that it will produce potentially the opportunity for the virus to resurge, which we absolutely do not want, because that actually would be more damaging to the economic situation.
Well, thank you very much. That's a great answer, and it clears some things up for sure. So we're almost to the end, and I'm going to pass it over to MLA Conroy now.
Well, thank you, Doug. And I want to thank Susan and Dr. Pollack for your time tonight. This is the third time that you've done a town hall, and I've been on 2 of them, and I'm just so impressed by your answers and your ability to just come up with really, really great answers and the knowledge that you have about this, because it's not easy for anybody, and you both have been exemplary in your work that you've been doing for the Interior Health Authority. So I want to thank you. And I want to thank everybody that got online tonight and sent your questions in. I know we couldn't answer them all. There was a lot of them, but I really appreciate the fact that people from right across the region want to know the answers to really good questions and want to understand what's happening in our province, because it is so critical. And everybody has done such a good job of lowering that curve. When Dr. Bonnie Henry first started talking about it, people thought, what is she talking about? And slowly we all learned what the curve was, and even kids know what the curve is. And it's done such a great service for the people of the province, because everybody's been really quite good. And I do want to thank Dr. Bonnie Henry and Minister Adrian Dix for the work they've done in getting that message out to us. And I think Dr. Henry's done it just about every day, and with very few breaks in between. And Minister Dix has gotten over to Victoria to do it as well. And it's been so comforting. We hear that a lot when we go out and about in the streets. We hear people saying we feel good. And Dr. Henry's calmness and her ability to give some really tough information to everybody in the province has been so well received, and people are responding to it really well. So a huge thank you to the people in the province. And I also want to thank my co-host, Doug Clovechok from Columbia River Revelstoke. I think this is really great. What this has done is showing people across the province that even though we're on opposite sides of the house, we can work together. We recognize the importance of working together, and that's been done right across the province. I think this is the 10th town hall meeting that's been had, something like that, across the province, and it's just so critically important that we can work together and share this information, because it's so important information. And to that end, we actually have some information we'd like to share about resources that are really important to all of you. And I'm going to throw it back to MLA Clovechok to start us off on that.
Yeah, you bet. Thank you very much, Katrine. And I too want to thank both of you for your efforts, and all the people like you in the health regions throughout the province of British Columbia. And credit to the people of British Columbia. We listened, and Dr. Bonnie Henry. I mean, she's got her own shoes. Come on, it can't be that bad, right? So she's just been amazing along with Minister Dixon. I also want to recognize Norm Letnick, who's our health critic, who's worked very closely with Minister Dixon. And these town halls were really his idea, and he's done really, really well. So proud of the people of British Columbia, and we've done so well comparative to other people, and we're not out of the woods yet. And that's, I think, a key message that we have to tell people. We're far from being over with this thing. So let's not take the foot off the pedal, but there's a lot of resources out there for you. So for provincial support and COVID-19 information, you can visit gov.bc.ca/COVID-19. This includes non-health related information such as finance, childcare and educational support, travel and essential services. And this information is also available by phone. And I can tell you this phone number works very, very well. You can call 1-888-COVID-19 or 1-888-268-4319, 7 days a week between 7:30 a.m. and 8 p.m. Pacific time. And of course, that's 8:30 a.m., 9 p.m. Mountain time for those of us who live over here. And for the latest medical updates, including case counts, prevention risks, and testing, visit BC Centre for Disease Control website at www.bccdc.ca.
And if you or a family member need additional medical advice, please call 811. And for seniors looking for additional support at this time, please call 211 or visit bc211.ca. You can also go to bc211.ca to sign up as a volunteer to support our seniors staying safe.
And you can find information, links to these and more additional resources in the description of this town hall below. And if you haven't already done so, please fill out the province-wide public health service BC COVID-19 Speak Your Story, Our Future. Really important that you take some time to do that. Local data is essential for communities to support public health planning, and your input equips medical health officers across BC to support our health and well-being, as well as learn live with the COVID-19. The survey takes about 10 or 15 minutes. So I've done it. It's easy to do. And so I encourage you to do that. You can do it online at bccdc.ca/COVID-19 survey or by phone 1-833-707-1900, 7 days a week between 8:30 a.m. and 4:30 p.m. Pacific Mountain.
Thanks for that reminder, Doug. I need to do my survey too. And as we move into phase 2 of BC's restart plan, let's give this every chance of success in this phase by continuing to do what we've been doing all this time, staying 100% all in. Let's continue to follow the public health guidelines to protect ourselves and our loved ones and stop the spread of COVID-19 in BC. For more information on our BC restart plan, visit gov.bc.ca/restartbc. And thank you again to everyone for joining us this evening. And keep well, be safe, and most importantly, be kind. Thank you.
Take care.
Thank you.
Good night.
Thanks very much.